Hi, everyone. Welcome to our social determinant of health. Sorry, I just got interrupted by this noise here. Our social determinant of health webinar on literacy and safety resources. So here with Sadia, we're from the Staten Island Performing Provider System, and this is our third in a series of now 4 webinars on social determinants and the local resources available on Staten Island to help connect people to address their social service needs. So just a few housekeeping issues and webinar notes. Everybody is muted. You should already have a little red muted sign on your webinar name. We're going to keep you muted throughout the entire presentation. Only the presenters will be given audio. If you have a question, though, we really encourage everybody to type them into the chat box, which can be found on the bottom of the GoToMeeting note section. So if you have questions, type them in the chat box, and then the speakers will address them at the end. And then the last thing is the presentation is being recorded, and it'll be shared on our website. So right now we have a wonderful presentation on food insecurity and a second on the housing resources and homelessness prevention. So you can check those out at statenislandpps.org. All right, so we're just gonna get started here. We have several speakers for today. Myself, I'm the Director of Health Literacy, Diversity, and Outreach at the PPS. My colleague Sadia, who will introduce herself in a few minutes. We have Joanne Springstead from the New Americans Welcome Center at the YMCA. Janera Bencoson-Gill from the New York City Family Justice Center. And we have Kenya Liriano from Community Health Action of Staten Island. And they'll each have an opportunity to share their programs with you later. Okay, so today we're going to be talking about social determinants of health. Literacy, we'll touch base on health literacy and safety, and then we'll get into the different resources available through the Social Determinant of Health app. So I'm just going to keep on going there. We are the Staten Island Performing Provider System. We are in existence since 2015, working on a Medicaid waiver. So Medicaid had reinvested about $8 billion into New York State, and these smaller groups were formed called PPSs, and they're really networks of health and social and behavioral health care providers. So the main goal of the Staten Island PPS is to reduce, and all PPSs, across New York State, is to reduce avoidable hospitalizations by 25% by 2020, and doing that by strengthening the care in the community and really working to address, the health issues that are impacting people on a local level. So far, we've invested $130 million back into the Staten Island community on this healthcare transformation project. Basically, every large, small private practice, long-term care facility, behavioral health, substance use provider, both hospitals, and about 19 different community-based organizations are our partners that makes up our network. And we've been able to, I think we're at over 60%. We've been able to reduce the avoidable hospitalizations in Staten Island by over 60% at this point. We're waiting to hear if there will be a District 2.0, but social determinants of health is going to be a key initiative in any kind of future state that we see in healthcare on Staten Island and nationally. Just to show you a little bit about how we do business at the PPS, data drives everything that we do. Every decision that we make, any way that there's funding or investments being made across Staten Island as part of this DSRIP or PPS initiative, we look at the data. So the data has transformed over the last 4 years. In 2015, we were looking at it. The top left-hand corner is called hotspotting. So the darker red areas are where people who have the most disease, and in this case, it's diabetes, are living. We were able to kind of sort of overlay data, but it wasn't anything dynamic. So the rainbow colors on the left are nation of origin. So we looked at kind of the race and ethnicity. We knew on the back end people's languages based on their potential race and ethnicity, and we can overlay gender and age at that point. So fast forward a few years, and now we have a very tech-savvy population health dashboard where each one of those dots represents an individual location. So this is where they live. Again, you're able to hotspot, but when I drill down into those dots, I'm able to pull up information like all of their primary care visits, their pharmacy usage, whether or not they visited the hospital, their race, ethnicity, language. Everything is built into this dynamic, searchable, changeable population health dashboard. And what's interesting about the Social Determinant of Health project that we're going to tell you a little bit about is that now, on top of people's healthcare status, we're going to be able to overlay data based on their social needs. So let's say we know on Staten Island and the North Shore that there's a transportation barrier. So we probably see a different color dot highlighted for people with asthma and transportation as a barrier to their lifestyle and wellness. So that's the future state of what this will look like after a few more months of collecting data through this initiative. So it's a really interesting way to look at people holistically, and then a community holistically through this lens of, hey, what's happening to them, and is this how we appropriate funds or advocate for policy change to impact some of these health and social issues. So speaking of funding, the PPS has spent over $7 million already in several social determinant of health areas. These are the main projects and initiatives that we've taken on over the last few years. So we have made a significant investment in community-based organizations and social determinants. So the question is, can we afford to neglect social determinants of health? So I found this pretty cool graphic for today's presentation, and it shows you that 50% of somebody's overall wellness can be traced back to their zip code. So that includes socioeconomic and the physical environment. Some things that we have control over individually, but some things are just a part of the way the structure of our lives have been built, so that we cannot impact them in a meaningful way alone. And you can see that health behaviors and health care, no matter how good of a job we're doing reducing those avoidable hospitalizations or providing the best quality care, if we're not looking at this whole spectrum of a person, we're not really able to impact somebody's overall wellness. And I hope that makes sense to you. And if you have any questions on that, please shoot them to me in the chat box. So the 80.5% is actually based on Staten Island clients with a chronic disease who are at risk for a second chronic disease. 80% of people that have a chronic illness report one or more social determinants of health. The average that Sadia will talk to you about is about every person is experiencing 2 social determinant or lifestyle or social factor needs. So this is continually something that is on the forefront of all of our minds and helping people address their social needs so that they could be healthier. So let's talk about social determinants of health. These are definitions from the World Health Organization. It's the circumstances in which people are born, grow up, live, work, and age, and the systems that keep us there. That impacts the way that we're able to deal with illness. And then if you think about that as like kind of a midstream or a downstream impact, the upstream impact is that there's all of these policies and government rules and regulations and economics behind why people live in certain places, why people are only attaining a certain level of education. So there's all of these higher issues that are shaping those other the social determinant circumstances. I wanted to just talk a little bit about literacy, health literacy, and safety to kind of set the stage a little bit for our conversation today. But I found this really cool infographic about education and how education and healthcare are linked. So we know that education is being recognized as an important social determinant of health. It's a really strong predictor of how well your quality of life is going to be throughout your lifetime. When you have better or higher or more education, it can increase your own individual capacity for making decisions about your health. That makes sense, right? The more I know, the more I have access to, the better informed I'm going to be, and the better informed my decisions are going to be. Education also plays a role in the way we have access to employment opportunities. You know, it's been all over the news, but if I have a greater chance of getting into a better school, I have a better chance of getting a greater job, right? And that's all linked to your income level and your experience with or without poverty, or your ability to get out of poverty at some point. It can all be tied back to education. So people who are educated have lower rates of unemployment. Unemployment is associated with poor health and higher rates of mortality. Yeah, I'm just going to answer, Sandra. We'll be sharing this on our website. It's a live recording of the webinar. If any, I hope you're all familiar with the Healthy People 2020. It's a report that comes out and kind of provides guidelines for a 10-year chunk of time. High school graduation is I want to say was, because we're at 2020, you know, basically in a month or so. But it was an objective of the Healthy People 2020 report. And here's an interesting statistic: 79% of public school students, completed high school in 4 years between 2010 and 11, and the goal was to increase that by almost 10%, bringing it up to 87% by 2020. So we'll see how well nationally we've been able to do there. But I hope this makes sense, right? Why is literacy a social determinant of health? Well, education plays an important role in our ability to get and understand healthcare, which leads me to health literacy. Personally, it's my favorite topic. And I think that, Sadia's laughing at me. I think that health literacy, if we help people improve their health literacy over time, we'll see a much healthier generation of people accessing healthcare, or maybe not even having to access healthcare. But yeah, so health literacy can impact everyone. It impacts people regardless of their age, race, income, or employment or education level. People who have limited health literacy, there are about 90 million Americans, they say, that have limited or low health literacy. If you don't understand your health information, you're unable to make decisions, it's not a priority, and you're unable to manage your health and wellness. Makes sense, right? People with low health literacy overuse the emergency department. They stay as inpatients on an average 2 to 3 more days longer than somebody with proficient health literacy. They cost the healthcare system on average about $168 billion a year. And the statistic is that if we spent $1 per person on health education, we would be able to reverse those trends over time. Health literacy impacts everything. It impacts our decision making. It impacts our understanding of medication, how to manage chronic illness. Healthcare it's hard information to understand. And if you have this literacy issue or this education issue to begin with, your health literacy status is likely to be very, very limited to impact you overall as a human being. Health literacy is different than literacy. You know, we like to say that literacy is your ability to read and write. And health literacy, you need lots of critical thinking skills. You need math and numeracy skills. You need to be able to navigate. And I can talk about this all day, but I'm going to stop there. I'm doing another webinar on health literacy coming up in the next week or two for Health Literacy Month. So I encourage you all to join there if you're interested. Yeah, so we're going to move on to safety. So safety, the definition is being protected from danger, risk, or injury. You might be wondering how safety is a social determinant of health. I always think of social determinants as if I don't have these things, I'm not able to concentrate and dedicate my time and energy to my healthcare because I'm too worried about all of these other things happening in the background of my life. So if you see in the second column, neighborhood and physical environment, that's where safety falls as a social determinant of health. Let's think about safety in the context of crime and violence. And in relationships, perhaps you experience crime or violence with partners, with family members, and then in spaces, in work or in public in general, in your neighborhood, if you don't feel safe and for example, if I don't feel safe in my neighborhood, I'm not going to be able to go to the park, so I might not get any exercise. So that might contribute to me being obese or overweight, and that is going to impact my risk for diabetes. So as you can see, it is all connected. People who are exposed to crime and violence are at risk for poor long-term behavioral and mental health outcomes. My experience with this comes from working with immigrant populations who had experienced some form of trauma on their immigration journey to the United States and continue to experience trauma in the form of fear from where they live because they are immigrants. So I'm sure everybody can contextualize this a little bit differently, but our presenters will be able to get into this some more and talk about the services that are available on Staten Island. Okay, so again, please let me know if you have any questions about the things I've covered in the chat box. And now I'm going to introduce Sadia, the Director of Ambulatory Care Initiatives.
Thank you, Selena. Hi, everyone. So most of you guys know me by now. I'm overseeing the SDH program that we've implemented with over 19 partners, July of this year. So all the things that Selena mentioned, so we have been monitoring all of those factors as well as some other factors. So the purpose of the project and the program currently has been focused on identifying barriers by doing the social determinants of health assessment with clients, in where we really emphasize on navigators doing more in-person interaction than handing just a simple form to the client, because we want navigators to talk directly with the clients, make them feel comfortable, so that they can trust the navigators to share this confidential information. We also ask the navigators to make immediate linkages to the resources, and that's the whole purpose of the resource webinars. Also, that we have been trying to come out and educate more about what resources are available in the community in Staten Island for each of these factors. We also ask navigators to connect patients to PCP or insurance if they don't have one. And another thing that we really emphasize in this program in the PPS is closing the referral loop. It's not enough to just link a client to an agency to receive services or get some intervention. It's very important that we either follow up with the client or with the agency that we have referred the client to make sure that the client actually receives the services or is in the process to get the services. And you can see all the partners that have been part of this program to date. Just to share some stats on how the program has been going. The partners have done about more than 6,700 surveys with unique clients, which is really great. We think this is a program that we as a PPS started it for the first time, and all the partners have done a tremendous job in getting these clients engaged and doing these assessments. As you can see, and as Selena alluded to earlier, in average there are either 2 or more factors identified by with each of these clients. So you see there's more than 12,000 factors identified through those surveys. And the navigators in this partner organizations are ramping up in making those referrals as they identify the factors, which is why we're doing these resource webinars to educate them more. And you can see literacy, which is our today's topic, is 12%, has 12% prevalence for all the factors identified so far, which is a pretty high amount right after food and income. So we thought it's really important that we do have this webinar to educate all the navigators on what resources they can have handy to connect clients to. We also have primary care partners participating in this project, where they provide us data through their EMR. And in addition to providing navigators information on the resources, we have also equipped them with motivational interviewing training before we started the program. And since I'm on the webinar already, I want to just let you guys know, once again, we are offering another motivational interviewing training beginning of next year, which is January 7 and 14. It's a 2-day training. So if your navigators haven't already done the motivation interviewing training in June of this year, please ask them to register for the January training next year. And these are just some screenshots. Those who are on the webinar and you guys are doing assessments, it's, you guys know it by heart by now. These are just some screenshots on showing what are some contents that we have available in the app. It's very important that we capture the client's consent before we start doing the assessment, making referrals. And this one has screenshots of food and housing, but it follows the same for literacy as well. When the client identifies that yes, they do have issues with health literacy, then a pop-up comes up where they get a resource guide, and they also get a drop-down of options for the resources available. And the navigator can then work with the client, have a conversation as to what works best for the client, and then can refer them accordingly. And the client can also receive a text or email message saying what are the outcomes of the survey have been for that day. So they can have this handy, so when they go in for the service for whatever agency they're referred to, the information is more handy for them. And I think that is it from my side. Thank you all.
This is a screenshot of the referrals that our navigators are using, but let's get right into communicating with some of the local resources for literacy and safety services. So I'm just going to give a shout out to Joanne Springstead. She's the director at the YMCA's New Americans Welcome Center. And Joanne, we're going to be unmuting you now for the presentation.
Hello, hi everybody. So YMCA New Americans Welcome Center is pretty much the right name for it. I know most people know the YMCA as the gyms and the wellness centers, but we're actually part of the third branch, which is YMCA Staten Island Counseling, and that's where the New Americans Center is housed because it's part of that social service arm of the YMCA. So we're committed to serving the population, the immigrant population throughout all of New York City based on the needs and the interests. But this wellness center is focused, this welcome center is focused right on Staten Island. We serve every community on Staten Island. All are welcome. Our main purpose is to help people achieve English language proficiency because that's what they come for. That's what their personal motivators are to seek out a welcome center. Almost always they're looking for some cultural competency and ultimately on a path to economic and personal self-sufficiency. Next slide. So, okay, the statistics, these aren't even current. The canvas of immigrants, especially on Staten Island, is changing so rapidly that even numbers based on last year's report from the Mayor's Office on Immigrant Affairs, the numbers are already skewed forward. But at last report, 38% of the city's residents were foreign born. And I think we have some statistics on Staten Island. I think we're at 19 to be somewhere between 19 and 22% of Staten Island residents are foreign born, and almost half of the workforce citywide are immigrants. Almost 70% of the population speak languages other than English, and 23% don't speak as well as expected. 10%, I think it's more than that, but 10% don't speak English at all. Next slide. So here's some statistics. The statistics are a little bit dry. I don't love them, but it gives you an overview of how diverse the population is on Staten Island, which makes the teaching of English and the understanding literacy a little bit unique, because when people come from so many different places, their academic experience is quite different, their exposure to English is very different, and the cultural values that frame the context for learning English are all somewhat unique. So it's important for us to understand this in our teaching. But again, as I say, it's rapidly changing. If you look at the graphic, Latin American, which translates to Spanish speakers, are still a pretty big percentage of other language, but there's a big diversity of who the language learners are in this particular borough, which creates a lot of excitement around the teaching, but also presents some very interesting challenges. Next slide. So we serve individuals 17 years and older and their families. And that creates a little bit of a challenge, which we'll talk about later when we talk about advocacy and funding. But Staten Island has 30,000 residents who immigrate from Latin America alone. And notably, the number of immigrants from Mexico has been on the decline in New York City, while populations from both Dominican Republic and China have been growing, really growing in leaps and bounds. But Staten Island continues to have a very large proportion of residents from Mexico and Central America. When you look at the 5 boroughs, 200 languages spoken, and I can vouch for that in my years of teaching on Staten Island. I've personally encountered people from 77 different countries speaking over 50 different languages just in Staten Island. The top languages, you know, I don't think it matters as much as understanding that most of the people who speak those languages are not speaking very well. They're not English proficient. Next slide. So undocumented. The YMCA serves undocumented immigrants at the New American Welcome Center as long as they're 17 and up, so that we're in compliance with the New York City school laws, and we'll talk a little bit about the gap that creates for some almost adult minors. But the hardest to serve population are the newly arrived minors who've been out of school, usually because of what it takes for them to get where they're going and settle in a city like New York or a borough like Staten Island. So in addition to the fact that they may not have been in school in the place they came from, they probably have been out of school for upwards of a year, just resettling, right? So now there's no grade equivalent to place this person into a public school system. So if they're under 17, if they're 15 or 16 and they're not going into the public school system, we've got a pocket of population that's difficult to serve. And in the case of the New Americans Welcome Center, through our referrals and our partnerships, we try to connect these people to other social services that might help them fill in that gap. But as a community, we're not well prepared to serve that population. But when it comes to the remainder of the population, no ID is required. We ask the status only to the extent that we can make referrals accordingly. We don't want to send people who are not well documented to other social services where they could be turned away or be going down a slippery slope. So to the extent that we want to refer them appropriately to other services, we will ask for their ID or their status, but it doesn't change the way they receive our services. Next slide. So usually people come here looking for English, but also looking to make the connection, because there are a lot of ways to learn the language at home or on the block or in the neighborhood. Usually they're coming to programs for that social piece of it. And also, once we start helping them communicate, we're a portal for all of the other things that they need. In some cases, they may need higher education, and in other cases, it's very, very basic because they have very little formal schooling. but language is always at the core. So we have ESL at several levels, but we target those who need the most, which, as Selena said in her piece on literacy, is the people who've had the least education, so that we could contextualize other learning around the English, which is not necessary in people who have high levels of literacy in their native language. Citizenship prep is another pathway. Most other providers of ESL do not have citizenship preparation because it's so specialized and short term, so you don't have a lot of retention with students who come for citizenship prep, but nonetheless, we offer it. People do not need to be enrolled in any of our other services. If that's all they need, they're welcome to that. It is taught by a professional educator and supported with tutor volunteers. Same with job preparation. We have one formal class that is a workforce readiness class, but again, within case management and other instructional pathways, there's basic job preparedness, getting into the job market, understanding what jobs are available and the criteria for that, and of course computer literacy, which is becoming more digital literacy than computer literacy because people rely on portable and remote devices, but clearly for language learners especially, they do rely on those devices for translation and very immediate information. So that we have a computer literacy class, but digital literacy is scaffolded into all of our ESL classes. So again, the Welcome Center is designed to be a safe space for people to ask those questions, to understand the bureaucracies, the different agencies, their eligibility and access to all level of social services. So, and also to have somebody help them clarify their own new goals. The goal first was getting here. Now what? What are their personal goals? What's driving their need to learn the language? And we sort of try to frame our instruction around those collective needs, but also determine how we connect them to other partners out here. Next slide. So classes. Our classes are multi-level. We try, again, within groups to level the students at the levels of competency, but it's a very difficult thing to do with the mixed population and with the limited funding. So if possible, we'll place students according to their level, but when necessary, if we need to put them in the class because that's the class they can access by location or by transportation, we allow for that as well. Some of the classes are supported with technology, some are not because they're just in places that it's not physically possible. We have classes several days of the week, day and night. Typically, our instructional cycle runs 10 weeks, 4 cycles a year. Some of the classes run 9 hours of persistence a week, others are 12. And students can remain through multiple cycles until their personal needs are met, or if they have a change with the occupation or their work schedule or their family obligations, they can change classes. They can go from one class to another according to need. Again, the curriculum is basically, for many of the people we serve, these classes are the only formal education they're getting. So in addition to language, we really work towards providing the context for the language they need. When we talk about civics, we're talking about local civics. Where are the hospitals? Where are the schools? Getting through bureaucracies, basic health information, health literacy. Selena kind of stole my thunder a little bit with her enthusiasm for health literacy, but health and nutrition are obviously high on the list of interest for adult learners. So all of the classes touch on that, and some classes dive deeply into it. Usually the curriculum is driven by the response of the adult learner. They express the things they're interested in or where there's a learning deficit, and the teachers are professional enough and have enough resources to answer that need in their instruction. So again, we have the instruction, but we also have a lot of one-on-one case management where the students come in when they're not in instruction and get help with the other things they need, completing paperwork, understanding instructions that come home from school, referring them to jobs, helping them do job applications online, helping them redo their resumes, connecting them to Workforce One. The workshops, those are great because you don't have to be a student in our literacy programs. They're open to the community. We partner with several public schools. We partner with the other CBOs, other stakeholders, employers, potential employers, and we open them up to everyone. The series is up there. Like you see, the Know Your Rights has been an extremely high priority because of the political canvas with the immigrant population. Financial literacy is a staple, and that's at many different levels, to basic numeracy, to cyber safety, safeguarding your credit, understanding credit, things like that. Nutrition and family, starting growing business, the breast health and cancer screening, which our longtime partner, Barbara O'Brien, has been fabulous with. She continues to serve wherever the classes are, she'll go. Getting ready for school, helping people understand parental engagement, which is a huge challenge for a lot of immigrant parents whose home countries didn't have that concept of heavy parental engagement in schooling. So we work on that, understanding the financial aid system for higher education, which again, you don't have to be a foreign language speaker to be confused by that. So we work on things that we know are universally valuable while people are learning English. What can they do with this information? And at the bottom, you see understanding your health insurance. That's a very popular one because whether you're insured, minimally insured, or underinsured, everybody's got questions around that one. So next slide. Community advocacy and support. One of the great things about Staten Island, I know Celine is going to speak on behalf of one of the other language and literacy providers. One of the great things is that we recognize that Staten Island is underfunded for a lot of these essential services, and so we really collaborate with each other. We advocate as a group, and we refer as a group. We make it our business to know what each has and how to access it. So if someone comes to me as a potential learner and I can't serve them, if I don't have what they need or they can't access my locations, we pick the phone up and we make those appointments, whether it's the JCC or the New York Public Library or the CUNY system, and we find them what they need. Again, our focus is on education, but that may be other social services as well. The advocacy, again, comes down to funding, especially going back to Selena's point about health literacy. Health, family, and financial literacies are underfunded because it's harder to show measurable gain in those areas, and most of the government funding just won't put their money where they can't measure an educational or an employment gain. The other issue where funding is sorely lacking is the pocket of people who are lacking adult basic education in any language. That means they're marginally literate in English and or first language, but they're not going to get a GED or HSC outcome anytime soon, and they're not a new language learner. So there's this pocket of almost impossible to serve people because we don't have a formal education system that just addresses their literacy. Likewise, you have a lot of people who score out of ESL programming because they speak English really well, but they're not measured for their literacy skills, which is their reading and writing. And because those skills aren't measured, we can't give a rationale for keeping those people in instruction, even though they really do need a lot more support with both language and literacy. So if we were asking our partners to come on board for additional funding, it would be to sustain services for those populations which are marginalized by the programs as we know them. And again, finding money, bringing back health literacy and family literacy as a social determinant of health, and as literacy that should be taught in its own right, and not something that brings necessarily home a paycheck, but ultimately has a very high value to the stakeholders. So how would you make referrals? Biggest thing, just pick up the phone and call us. Our literature is anywhere and everywhere. If you want it, we'll make sure you can have it. Word of mouth from the students is the biggest way that people come through our doors. But when it comes to you guys who are listening as our partners in the community, you can just send people to our main address, or preferably by appointment so that they're not waiting, or there's no confusion. If you pick up the phone and make an appointment, we'll see them. Our enrollment is open, although we try to get people in within the first 2 weeks of each class cycle. We can register them and put them on waiting list, or if they have an urgent need, we'll make exceptions and we will put them into a cycle midterm. So we really try to handle everyone on a case-by-case basis. But that's it. Give us a call or send them our way and we'll take care of them.
Great. Thanks so much, Joanne. That was really, really helpful, and loved all the information on the breakdown of languages, the immigrants, and of course, advocating for health literacy. So our next presentation is going to bring us into the social determinant of health safety resources. Let's see, we're going to have Jainera from the New York City Family Justice Center, the Staten Island Division. She's going to tell us all about the services available there.
Hi, everyone. Thank you, Selena. So you can go to the next slide. Thank you. So an overview of the Mayor's Office to End Domestic and Gender-Based Violence. Some of you might know us as being the Mayor's Office to Combat Domestic Violence, because that was our name before. In 2018, in September, the Mayor expanded our purview of the office and now includes domestic violence as family violence, intimate partner violence, which includes sexual assault, stalking, human trafficking, and gender-based violence. This expansion aligns more with our mission to provide services to all victims of DV and GBV, so DV, domestic violence, GBV, gender-based violence. Our office develops policies and programs and provides training and prevention education. We conduct a lot of research and evaluation. We perform a lot of community outreach, and we operate all the family justice centers throughout the 5 boroughs. So as the administrative team, we do not provide direct service to the client, but we operate the family justice centers. We also collaborate with city agencies and community stakeholders to ensure that access of services to survivors of domestic and gender-based violence are inclusive. So we can go to the next slide. Thank you. So the Family Justice Centers are a practice model that provide comprehensive, holistic services to victims of domestic and gender-based violence. There are over 100 FGCs in the United States. Let me see, the purpose of the Family Justice Center is to provide a safe place for clients and their children to walk in and access criminal, civil, legal assistance, case management, and adult counseling, economic empowerment services, wellness services in a helpful and non-judgmental environment. And then the Family Justice Centers are also a place for partner staff to maintain autonomy, confidentiality, while collaborating with other professionals, receive ongoing training. So we provide many different trainings like in immigration law, family court, criminal justice response, housing, IPV, and LGBTQ relationship. So many different trainings, and learn about different roles of professionals in the field. So one of the things about the Family Justice Center is that although all the agencies are located at the center, they each provide different services, and they each have their own system or like intake on how to provide services. You can go to the next slide. Thank you. Okay. So our goal here at the Family Justice Center is to reduce the burden on the survivors to locate services. So instead of survivors having to go to different locations, they have everything all in one location. Everything is client-centered, so the client can decide what kind of services they are willing to engage with. We increase the number of access points to services since we have case managers, we have counselors on site for adults and children, we have a therapist, we have a psychiatrist, we have attorneys, we have NYPD on site. We also have a collaboration with the district attorney's office that increases all the access points for everyone to receive services. We provide culturally and linguistically appropriate services. We increase coordination among service providers. So if a client comes in and let's say it's a high risk case, or it's a case that requires a lot of different service providers to be involved in the case, we get everyone together to talk about that case. Its goal is also to implement systems improvements and increase safety. So the fact that a client doesn't have to go to different locations to receive services, they only come to one location. It increases safety for themselves and their children. Go to the next slide. Okay, so these are some definitions of domestic violence. So when we talk about domestic violence, there's intimate partner violence and then there's family violence. So intimate partner violence, we see it as a romantic partner, somebody who's is dating or has previously dated, someone, a partner who is on and off. They're either married, separated, or divorced, have children in common, or living together or apart. And then some of the language that we also use is a person experiencing abuse, person being abused, a victim or survivor. It depends how the person who's coming in and receiving services, how do they identify. We try to mirror their language. And then we also use person using abuse, person being abusive, an abusive partner, abuser, batterer, or perpetrator, or person causing harm. It depends, like I said, what the person who's coming in, how do they identify their abusive partner. And then domestic violence is a range of coercive and abusive behaviors used to gain and maintain power and control over an intimate partner, creating a fixed imbalance of power with an overall effect being one partner having control over the other partner. And then in family violence, we are seeing all kinds of violence. So violence against like someone and their child, their teenage child, someone, their grandchild, and brothers and sisters, what else? Cousins. So that is what we mean by family violence. Step parents, step sister, step brother. That is what we mean by family violence. Okay, so next slide. And then some under terminology. So gender-based violence is a general term used to capture any type of violence that is rooted in exploiting unequal power relationships between genders. This can include gender norms and role expectations specific to a society, as well as situational power imbalances and inequities. Okay, so these are just some stats. This is specifically to Staten Island, so we wanted to give you a picture of how things are looking here. So in 2018, there were 6,648 intimate partner domestic violence reports in Staten Island. So domestic violence incident reports are reports that police take when they arrive to like a situation or arrive to the scene of a crime, and they have established that it's domestic violence. These are the forms that they are filling out. There were 161 intimate partner felony assaults, 23 intimate partner rapes. There were 4,610 family-related domestic incident reports in Staten Island, 99 family-related felony assaults, and 14 family-related rapes in Staten Island. And go to the next slide, thanks. Okay, so the type of clients that we're seeing at the FJC are, so one of the things about the Family Justice Center in Staten Island is that we are co-located with the District Attorney's Office, and clients who have either called the police, had their abusive partner arrested, they come in and walk into our doors to receive services. They usually also come in to meet with the District Attorney's Office to, to talk about the incident, to verify the incident. And when they come in to meet with the District Attorney's Office, they are introduced to all the services here at the center. We are a walk-in center, Monday to Friday, 9 to 5. No appointment is needed. And when a client comes in, they can just let the front desk know that they are in need of services. Once that happens, the client will be screened. And screening is more of like just getting demographic information, explaining to them what the Family Justice Center is, giving an opportunity to hear their story and see what services we have here that can match their need. We, like I said before, we have 2 NYPD officers on site that can take police reports of clients, can get copies of police reports, copies of the order of protection, but a client can come in and not be involved with any of that. We are client-centered, so the client decides what they want to be involved with and who do they want to connect to. We do have some clients that do make appointments. Sometimes they reach out to other service providers that are on site, either through their like hotline number or their main office number, and they make appointments to meet with them here at the center. Okay, this is different services that we provide here. We have every client that comes in after they are screened, and we determine that we do provide the services that they are in need of. We connect them to a case manager. The case manager always does a risk assessment, safety planning. If they are interested, can advocate around prosecution, assist them with filing police reports, connecting them to the NYPD officers. We provide individual and group counseling for adults and children on site. We have a psychiatrist here on site. She's here 2 days a week, and she does medication management. We also have like children's activities, family activities. We have a literacy program. We also have case managers who do shelter and housing advocacy, and we have a financial literacy course here. It's 8 weeks, and it's in the evening. We have a financial planner who facilitates that group and goes over budgeting and taxes and investment and how to talk to your kids about budget and savings and all that stuff. We also provide services for elderly and people with disabilities. So we have organizations like CASC and Staten Island Independent Living provide services on site. We have practical assistance like food and clothing. So a lot of clients either come into the center and they have to go into a shelter or have to go and stay with family or friends and do not have the possibility of going back home and getting food. So we provide that here. We also have clothing. We have an immigration attorney on site who can talk to clients about their immigration status. We have attorneys here that are housing legal attorneys. So clients that are being evicted, clients that have a voucher connected to the abusive partner and need the abusive partner to be taken off of that voucher and or apply for a different voucher. We have attorneys that can guide them through that process. We have also a matrimonial and divorce assistance, law assistance. Like one thing that our case managers do here on site is that if a client does not feel safe going to family court, our case managers have the ability to file for a petition online. They can file through the Family Justice Center and then appear electronically or via Skype in family court. Okay. So one thing about best practices when discussing the Family Justice Centers, we just ask people to manage expectations. We, offer advocacy. We do not have any housing here available. We are a walk-in center. Sometimes there is long waits. We don't promise clients that they will get an apartment. We also ask that you have the conversation with clients about us being co-located with law enforcement and just letting them know that we do have security for, for safety. And then letting them know that they can walk in, but it might be best to email one of us. Our contact information is on the last slide. Email us and let us know and give us a heads up of who's coming in. And then we have an online New York City resource portal. It's called New York City Hope. You can guide clients through that portal. You can get information of all the services that are offered throughout the 5 boroughs, especially here in Staten Island. And then you can give us a call. I gave all of our contact informations of the administrative team here at the Family Justice Center in Staten Island. So it's the last slide. Thank you.
Thanks, Janera. That was super helpful and alarming to see some of those statistics that you shared.
Yes.
I know how difficult it must be to work with clients that are going through this kind of trauma, but we are so happy to know that this resource in the community exists. So thanks so much for stepping in and presenting for us today. Anybody has any questions for Janera or the Staten Island Family Justice Center, please go ahead and type them in the chat box. Our final presentation is going to be Kenya Liriano from the Community Health Action of Staten Island's Domestic Violence and Trauma Service Department. So we're going to unmute you now, Kenya, and thanks so much.
Thank you. Thank you, Celine. So just to give you a brief history of Community Health Action, most known by CHASI, for those of you who don't know, we started actually as a Staten Island AIDS Task Force in 1988. It was formed by a community of activists and volunteers as a response to the AIDS epidemic during that time. In 2004, we changed our name into Community Health Action of Staten Island, and 11 years later joined our parent company, BrightPoint. We went most recently to another change and for expansion, and in 2018 we joined Hudson River Healthcare. So now we are Community Health Action of Staten Island, a member of Hudson River Healthcare. that is allowing us to expand our reach not only to all the boroughs, but now areas including upstate New York. Next slide, please. So just to give you an idea of the different services, not only domestic violence, but there's a great variety of services that we offer. So we have a very robust Medicaid health home case management program that assists clients and or patients with their chronic illnesses. We also have HIV/AIDS specific care coordination, health management services. We have an initiative through City Council with a vital hepatitis initiative, including Hep C and Hep B, which we also provide a robust care management to those affected by Hep B and Hep C. As we also have a community food pantry, they presented before, so I'm sure most of you are aware. We also have a mobile food pantry, a harm reduction hub program for people dealing with substance use. We have workshops available, groups available, as well as an exchange. We also deal with chronic disease self-management workshops, including diabetes, high blood pressure, and any other chronic diseases. We have our Next Step Resource and Recovery Center, which is very exciting. This is 24/7 center for not only people who are dealing with substance use, but also with families of those affected. And as I said, they're open 24/7, and they are actually the hub who can refer us at any point, any time to all these services. We have a learning lab at the food pantry. We also have our mobile health unit who goes around canvas all Staten Island. And most recently, we have the Arise Peer Training Institute for people in recovery so that they can become certified recovery coaches and get ongoing professional development training. We have HIV programs in all of the prisons, most of the prisons, Queensboro, Lincoln, and HCOM correctional facilities. SNAP and benefits, and through our Brightpoint parent company, we are able to offer outpatient substance abuse treatment on site at 56 Bay. We also have primary care, behavioral health, dental services, pediatrics, OBGYN, and also in partnership with the Pride Center of Staten Island. Now they are their own nonprofit, but we work very closely. We are able to refer and work and collaborate to provide direct local access to LGBT community. So that also, my last is the domestic violence and trauma services that we provide, which is the program that I am here to present. But our goal really as an agency is, or as an organization, is really to remove barriers between clients and to be able to improve the health. Somebody can walk in here with DV issues, and they will have access to a community vast network of wraparound services addressing most of the social determinants of health. So that's why we're here. And we measure our effectiveness in part by our client engagement in healthcare, as well as the follow through on their care plans. Next slide, please. So Community Health Action of Staten Island recognizes domestic violence as an important social determinant of health. And as you heard from Janira's presentation, domestic violence incidents have been on the rise in Staten Island. Becoming a public health issue, right? So we want to make sure that we are there to support, to provide resources, that we are there to work with the clients and patients so that there is not a new epidemic as we have seen with the opioid epidemics on Staten Island. We want to make sure that we are there to provide services. So just to give you a few stats in the next slide, please. From 2019 and 2014, Staten Island had the highest increase in domestic violence victims of any borough, according to the DA in one interview that they made on March 4th in 2019. Since 2008, DV arrests are up to 85%, right? And Janira gave you a breakdown of all the incidents. That was like intimate partner violence. But if you, just in 2018, including non-IPV, there were over 10,171 domestic violence incidents. And what we're seeing is not like, we might say, oh, so there is an increase on violence on Staten Island, but it's also what's happening is that there is more as a result of the great collaboration in between networks of agencies and organizations. We're seeing more people able, more willing to report and seek out help. So we thank the Family Justice Center and their presence and outreach for that. But unfortunately, domestic violence continues to be on the rise, and in comparison to other boroughs like Staten Island, is still there is a monumental disparity. Next slide. So Chassis started providing domestic violence services in 2013. That's when we expanded our portfolio of services from, HIV case management services and substance use services to like domestic violence programming. And we began providing evidence-based trauma-informed care to domestic violence and intimate partner violence survivors. And this was in partnership with the Richmond County Attorney's Office. And through this collaboration, Chassis has served over 1,100 people through our DV services. We also piloted a program, is good to mention, although most of the work has been with women, we did pilot a program focused on the domestic violence offender, although due to funding was discontinued, was very successful, and it showed us that in order to achieve the whole paradigm of domestic violence, we really have to pay attention and be able to see the entire family when it comes to DV. So since 2016, from 2013 and 16, we were awarded a grant from SANCHA and we were able to serve in that particular grant 301 females towards self-sufficiency. And then after the grant ended, we continue the services. The agency has a commitment to continue to serve domestic violence victims, and we continue to provide those services. And we were one of the initial organizations to partner at the Staten Island Family Justice Center, and we are still there today providing counseling services and a variety of services through our office at the FJC and also in our office at 26 Bay. So we do a lot of local advocacy. The next slide, please. Last year, we had a very successful Denim Day. It has been our 4th year in partnership with the Richmond County Attorney's Office to ensure that a lot of our clients that we serve are present in the rallies and are able to show a face to domestic violence. And there was a lot of activities going on. I will want to encourage you this year to participate, all of the organizations that are joining us. If you can make a choice to participate and continue to support those efforts, Denim Day is has become a big event on Staten Island, and it is a powerful tool to just honor and those people who have dealt with domestic violence. So just to give you a little bit of internal data through this is only for the referrals from the Richmond County Attorney's Office. In 2018, we served 190 high-risk strangulation survivors. Out of those, 31 declined services. It's very difficult sometimes for victims to get the services, but like we had a very good response of 164 who received one or more core services. This is only one of the contracts with the RCDA. So next slide. Some of our core services are obviously early intervention and outreach. We provide crisis intervention. We have a robust safety planning, which is very tied to, we go over all physical, emotional, Sexual, we have a very big part in the sexual health, and how sexual health is a big component of safety planning. Like, we see that a lot of domestic violence victims, unfortunately, are unable to negotiate the use of safer sex practices due to coercive partners. So we see a lot of counts of rape and sexual assault within our cohort or survivors. So sexual safety planning is a big part of what we do. We also have referrals and linkages to many other different services. We think, as you saw, like at the beginning of the slide, we have many services, food pantry, benefits, so we can refer internal or external, since we are also at the Family Justice Center. We do escort to court appointments or any other appointments that are important to the DV survivor. We provide advocacy and case management support, and then the linkages to all service needed. Next slide. So the way that you can refer clients to us is very simple. The best way to connect a client, I put our direct extensions, so you can reach me at 718-808-1330, or our counselor, Rose Bolela, 718-697-4328. They're in there. I can also forward your email addresses. You can also, we have an office within the Family Justice Center, so you can walk a client or ask for chassis if you want a specific chassis services through the Family Justice Center. We work with any people of any gender. We have not as many males in our cohort, yet we serve everybody, LGBT community, population, women, transgender, male or female, they're all welcome. We both do IPV and non-IPV, so like it could be somebody that is dealing with domestic violence due to brother, sister, mother, like we see that often. So we are able to serve them. Our hours are Monday to Friday, 9 to 5, but our counselors are able to work with case by case. If people have work and they have to schedule appointments or come to see us at a later time, we're able to accommodate those as well. If you want more information, please feel free to reach out to me or the counselor, and we will be able to give you more. We have much more information that we can make available to Celine so that she can make available to you. Thank you for the opportunity, and I hope that this was helpful.
Thank you, Kenya. Thanks to all the presenters. I'm going to go very quickly through the last couple of slides and share the Jewish Community Center's literacy service resources. Again, we'll share these slides with all the attendees, so you'll have the resources. The Staten Island Jewish Community Center serves over 40,000 residents, including 8,000 youth. They have 30 satellite locations across the borough. And literacy and education are some of their major initiatives. They also, similar to the New Americans Welcome Center, they also offer classes in high school equivalency, English as a second language, helping find employment, citizenship, and helping parents become active in their child's education. This year, they're set to serve approximately 800 students throughout their 25 locations island-wide. So there's a lot going on Staten Island. I know a lot of you are making your referrals through the navigation program to the Jewish Community Center. I have a couple of flyers that we'll share with you that has information on how to access the high school equivalency and the English as a second language classes on Staten Island. So not to delay question and answers any further, we're going to get into them now. So we'll be asking the question, targeting and inviting the appropriate presenter to unmute. So the first question is going to.
So it's from Serena, and it's for YMCA Joanne. Are there any GED classes offered during evenings or weekends for working people?
And
Okay.
Joanne, you're unmuted. Go ahead.
So, thank you. Clarifying, we don't have GED. We have ESL and workforce, and they are available at nighttime. For GED classes, we do refer to the JCC, which has an excellent program. And one of the things that we do, if it's a language learner, we assess whether they actually need GED based on the credentials that they bring with them. But if they do in fact need that, then we pick up the phone and send them to our friends at the JCC. And yes, they have classes at multiple locations, daytime and nighttime.
Thanks, Joanne. Thanks for clarifying that for the New Americans Welcome Center and for the Jewish Community Center.
Sure.
I saw a couple of questions come through, but I think that they were answered on, oh no, there's one actually. So this is for Janera from the Family Justice Center. And from Jeff. So does the Family Justice Center work with youth under the age of 18 without parental involvement? And for more specifics, it's child, parent, family violence victims. So let's unmute Janera.
Yes, we do. We work with clients, youth up to the age of 12 without parental, parental
Consent or supervision?
Yeah, consent, yeah, or permission. They can walk in if they're 12 years old and they can receive services.
So the suggestion to Jeff would be, yes, any clients ages 12 or older can just walk into the Family Justice Center and get help. Do they have to call ahead or certain times?
No, they can just walk in. They can just walk in. One thing that we say, if you're working with a client and you want to give us a heads up, you can definitely give us a call or email us and let us know that you are sending a client that you're working with. But it doesn't, you don't have to. You can just let them know that they can walk in Monday to Friday, 9 to 5.
Okay, great. Thank you. We'll be sending out contact information for everybody so that you guys could reach our presenters directly in their organizations. So Sandra, I know that you sent this just to me, and it was asking if we can get copies of the presentation. Sure thing. And then for anybody else who didn't attend, we have recorded the session, and it'll be posted live on our. It won't be posted live. It'll be posted on our website along with the other two social determinant of health webinars. So yeah, we'll send out a copy, a PDF of this presentation afterwards. I'm just going to look through the questions real quick. And I saw Serena, you asked a question, and Janera was able to chat with you via the chat box. So thanks. Does anybody else have any questions? You can write it real quick into the chat box. I think we have another few minutes. But I just wanted to thank our presenters and thank everyone for being with us today. And hopefully these resources can help you, your clients, your neighbors, and make Staten Island a stronger place to live through all this sharing that we're doing and advocating for our clients. Okay, I'm going to take one last look at the chat box. No questions have come in. Many of you have my email address. If something comes up down the road, please shoot me an email. I'll be happy to connect you with anybody from today's presentation. Okay, thanks so much, and we hope to see you on November 5th for our final webinar, and that's going to be discussing clothing availability, socialization services, and child care services on Staten Island. That'll round out our webinar series. And, on behalf of Sadia and I, thanks so much for joining.